We start with breaking news tonight, a turning point in Washington's fight against COVID-19. On the one-year anniversary of the World Health Organization declaring this a pandemic, Washington takes another step to normalcy. Thanks for joining us. I'm Neil Wong.
And I'm Aaron Luna. All 39 counties in the state are headed to phase 3 on March 22nd. Mayor Kawash explains what changes in Washington's path forward.
A big day for Washington. All COVID-19 data is trending in the right direction, and the state believes it's ready for things like this: 50% capacity at all indoor spaces. Now, the Mariners will also welcome fans back into T-Mobile Park on opening day. Inslee says the state is watching those variants, but he's confident about Washington's path forward.
But today we have a boatload of good news.
We're not quite used to hearing that, but tonight Washington breathes a sigh of relief. Exactly 1 year to the day after coronavirus was declared a pandemic, the entire state sets its eyes on phase 3.
We as a state have made such tremendous progress recently with our case rates and hospitalizations. Things are really going in the right direction.
On March 22nd, every county heads to phase 3, allowing 50% capacity at every type of indoor space. Indoor and outdoor events like live entertainment are now allowed 50% capacity or a max of 400 people with distancing and masking. And some more parents can stop watching their kids on Zoom. More fans are going to be allowed at high school and youth sporting events 1 week from today. Every county will stay in phase 3 until at least April 12th. That's when the state will evaluate each county by these metrics, which are focused on COVID-19 infections and hospital visits. The metrics differ for counties based on their population. Spokane and other counties with more than 50,000 people must have a 2-week case rate below 200. Right now, Spokane is at 146. And the 7-day average for hospital admissions must stay at or below 5. And then counties with fewer than 50,000 people must have fewer than 30 cases over a 2-week period. And no more than 3 people can be hospitalized with COVID in the last 7 days. Now, the state is optimistic about all counties staying in phase 3. And as for phase 4,
I can't give you a timeline. I say it's probably more probable that it would be shorter rather than longer, because I am very optimistic about the efficaciousness of these vaccines. I think they're going to knock it out of the park.
So the state will evaluate these new metrics every 3 weeks, and that'll happen on Mondays. If a county is not meeting all the requirements, then it'll move back a phase on that Friday. And if Washington has less than 10% of its ICU beds available at any point, they will move the entire state back to phase 1.